Hi, my name is Dr. Sandra Pagenta, and I'm a board-certified adult nurse practitioner. These videos are a review of our adult clinical specialty booklet. The key takeaways we will review in these videos are the health promotion of older adults, how to obtain a medical history, utilize a review of systems, and how to perform an adult physical exam. We will also review how to present an older adult to your preceptor, as well as common health issues with the older adult population. I work with an older adult population in my clinical practice, and honestly, this is the age I enjoy caring for most. As a nurse practitioner, you are very likely caring for older adults in your clinical practice. It is projected that in 2026, when the post-World War II baby boomers begin to reach age 80, that more than 20% of Americans, that's almost 80 million individuals, will be over the age of 65. Understanding the needs of this population will be important for the care that you provide for the older adult. Aging refers to the inevitable, irreversible decline in organ function that occurs over time, even in the absence of injury, illness, environmental risk, or poor lifestyle choices. While there is no set age to define older age, any age above 65 is typically used. As NP providers, our goal for our patients' health and well-being is that all people can achieve their full potential across their lifespan. So in order to increase an individual's health and well-being, we have to focus on the prevention of chronic disease through a holistic approach. A holistic approach to disease prevention focuses not only on the physical health status, but also on the mental, emotional, and social well-being of the patient. As an NP student, learning how to assess a patient's overall health status, identify risk factors, and develop a personalized health promotion plan tailored to your patient's specific needs should be the focus of your clinical rotation. Health education involves arming the patient with information to empower them to make the most informed decisions about their health. Learning how to effectively communicate strategies to educate patients on lifestyle choices, disease prevention will increase the likelihood that they will maintain wellness. Preventative care is a tool we use for preventing chronic conditions. This includes health screening, vaccinations, regular checkups, and performing risk assessments to identify potential health concerns early on. It is imperative to involve patients and their families in the health promotion plan. Tailoring care to the patient's unique backgrounds and beliefs, as well as preferences, is essential for patient engagement. I also encourage you to collaborate with healthcare professionals to provide a team-based approach to patient care. This ensures that patients have a wide range of resources and expert perspectives. As a matter of fact, 6 out of 10 Americans live with at least one chronic health condition, such as heart disease, diabetes, cancer, or stroke. Therefore, it is important that NPs be well-versed on evidence-based methods to help their patients avoid chronic disease as well as manage them. Using the best available research, staying up to date on the latest evidence and clinical guidelines, and integrating this into your practice ensures that the health promotion interventions are likely to be successful. By prioritizing health promotion, you can make a significant impact on the health and well-being of your patients and communities. At the start of any patient visit, begin by introducing yourself and explaining your role as their provider. Obtaining a thorough history and review of systems are essential components of assessing the health of an older adult, which can feel overwhelming at first. Don't worry, we have the tools to help you be successful. When working with older adults, it's crucial to exercise patience, respect, and sensitivity. Adapt your communication style to accommodate any cognitive or sensory impairments. Always prioritize the individual's comfort, autonomy, and dignity. When obtaining the history, start with the chief complaint, using the patient's own words if possible. For example, I have been more tired than normal. If the patient is not the historian, be sure to document who is. Next, obtain the history of the present illness by using the old CARTS acronym to help gather as much information as possible about the patient's problem. This acronym stands for onset, location, duration, characterization, aggravating factors, radiation, temporal factors, and severity. Ask questions about each of these areas to get a wider scope of the patient's problem. Then begin to gather relevant medical history by including the past medical conditions, past surgeries, hospitalizations, allergies, and current medications. Inquire about any family history of chronic diseases or hereditary conditions and use a family tree if possible. Be sure to listen attentively, showing empathy and asking open-ended questions to gather as much information as possible. Include with the social history information on the patient's occupation, level of education, tobacco, alcohol, or drug use, sexual history, advanced directives, and any religious or spiritual beliefs. When you have obtained this information the first time, it is not needed at each appointment, since you have a working knowledge of the patient's history. Older adults have nutritional challenges that make it important for a healthcare provider to address during their healthcare visits. Inquire about any special diets, their dietary fiber intake, changes in weight, their ability to chew and swallow, any issues with dry mouth which can occur from the use of medications. You may also ask about any change in urinary symptoms that would reduce their fluid intake, such as urinary incontinence. The older adult can also experience physical limitations with preparing food as well as financial constraints in purchasing food. Be sure to inquire about these as well. And finally, make sure to assess their functional status. Evaluate the older adult's functional status, including activities of daily living and the instrumental activities of daily living. Examples of ADLs include personal hygiene or grooming, dressing, toileting, transferring, ambulating, and eating. And then inquire about their ability to perform self-care tasks, mobility, and any limitations or assistance that they require. You can assess a patient's cognitive function by evaluating their memory, attention, and orientation. There are specific scales for assessing these in older adults, such as the Modified Katz ADL scale or the Lawton Instrumental ADL scale. Some patients have a fear of hospitalization, difficulty recalling past medical history, and an atypical manifestation of a disorder that make taking the history of an older adult more difficult. You can prepare for these challenges by having rapport and knowing your patient's detailed history. After obtaining the history, start by going over the review of systems. The review of systems is a systematic review of different body systems, including the respiratory, cardiovascular, GI, GU, musculoskeletal, neurological, and sensory systems. The review of systems can be used as a way to inquire more specifically into a body system the patient may be complaining about and catch symptoms that they might have forgotten to mention. Inquire about symptoms such as shortness of breath, chest pain, fatigue, dizziness, bowel or urinary changes, or difficulty with mobility. When obtaining the review of systems with an older patient, they may not report symptoms that they may have incorrectly considered a part of normal aging. However, no symptom should be attributed to normal aging unless it's been thoroughly evaluated and other causes eliminated. Hey guys, for this lesson, I brought my co-creator, Jackie, to help me go through the material. Performing a thorough physical assessment is a critical component of caring for your patient. It helps healthcare providers gather objective data about the patient's health status, identify potential health issues, and develop an appropriate treatment plan.
Before starting the physical assessment, ensure that the environment is comfortable, well lit, and private. Gather all necessary equipment such as a stethoscope, blood pressure cuff, thermometer, reflex hammer, otoscope, ophthalmoscope, and measuring tools. These items can be scary for children, so we suggest using kid-friendly items and introducing them in a fun way when examining the pediatric patient.
Certain age groups require a tailored approach to the physical exam. For infants, we recommend assessing the patient lying in the parent or caregiver's arms and leaving ears, eyes, and the mouth to the end and using the least to the most invasive approach. Assess the heart and the lungs when the infant is quiet or asleep, and try distraction techniques with older infants. Infants less than 6 months are best examined on the table.
For toddler-aged children, use minimal contact, allow inspection of your equipment, like the stethoscope, assess the heart and lungs, and then proceed with the head-to-toe approach. This approach also works well for preschool-aged children.
For school-age children, the provider should make sure to respect privacy, explain the steps of the visit, and approach to the physical exam before beginning.
For the adolescent patient, the physical exam is similar to that of the school-aged child. Be sure to explain physical findings, respect privacy, and ask parents to leave the room during part of the exam to gain rapport.
When starting a comprehensive physical examination, maintain open and effective communication with the patient. Explain each step, address any concerns or questions, and ensure their comfort and dignity. This will help with building rapport with your patient. Be sensitive to the patient's age and cultural background. Adjust the assessment techniques and communication style accordingly to ensure the patient feels respected and understood.
Begin the exam by assessing the patient's vital signs: blood pressure, heart rate, respiratory rate, and temperature, and general appearance, noting the patient's behavior and overall condition. Note any signs of distress, discomfort, or abnormalities.
Now it's time to perform the head-to-toe assessment. In this assessment, you will systematically assess each body system from head to toe. This typically includes the following areas. For the head and neck, inspect the scalp, face, eyes, ears, nose, mouth, and throat. Palpate lymph nodes and assess the range of motion of the neck. For pediatric patients, be sure to assess the fontanelle size, the eyes for the red reflex, and the mouth, noting the number of teeth present.
Moving on to the chest and lungs, auscultate lung sounds using a stethoscope and assess respiratory effort, symmetry, and any abnormal breath sounds.
For the cardiovascular system, auscultate S1 and S2 heart sounds and assess peripheral pulses, jugular venous distension, and edema.
For the abdomen, inspect, auscultate, percuss, and palpate the abdomen to assess for tenderness, organ enlargement, masses, and bowel sounds. Note that infants usually have protuberant abdomens that become more scaphoid as the child matures.
Musculoskeletal system. Observe range of motion, muscle strength, joint stability, and any deformities or abnormalities. In the pediatric patient, note any signs of lordosis, scoliosis, kyphosis, or sacral dimple. Additionally, physiologic bowing is often seen in children under 2, before spontaneously resolving.
For the neurological system, you're going to want to assess their mental status, cranial nerves, motor function, sensory function, reflexes, coordination, and gait.
The integumentary system. Inspect the skin for color, temperature, moisture, lesions, rash, and wounds. Assess skin turgor and perform a full body skin assessment, including the scalp, nails, and mucous membranes. Evaluate children for birthmarks, hemangiomas, and Mongolian spots.
For gender-specific assessments, evaluate the genitalia, perform a breast examination for females, and assess urinary patterns and function. Note the Tanner staging in the pediatric patient. For the gynecologic patient, a speculum exam is used as well as a bimanual exam to assess the vagina, cervix, uterus, and adnexa. Be sure to include a focused examination based on the individual's presenting concerns or symptoms. When documenting your findings, include pertinent positive and negative findings, abnormal findings, and any concerns or observations. Use clear and concise language, ensuring the information is organized and easily understandable.
Use appropriate terminology and include relevant measurements, abnormalities, and any subjective information reported by the patient. A comprehensive physical assessment should be tailored to the patient's needs and pertinent to the chief complaint. The immunization schedule for adults may vary depending on factors such as age, health condition, previous immunization history, occupation, travel plans, and specific risk factors. However, here is a general guideline for recommended vaccines for adults in the United States. We will briefly review them here. Influenza vaccine. the COVID vaccine, the Tdap vaccine, the varicella vaccine, the MMR vaccine, measles, mumps, and rubella, the pneumococcal vaccine, the hepatitis A vaccine, the hepatitis B vaccine, the HPV vaccine, the meningococcal vaccine, and finally, the zoster vaccine. We have provided the full CDC recommended vaccination schedule in our clinical booklets for your viewing. For more information on the recommendations about vaccines, visit the CDC's website. Presenting a patient to your preceptor involves providing a concise and organized summary of the patient's relevant information. Remember, it's important to tailor the presentation to the specific needs and preferences of your preceptor. Present the patient information in a concise, organized, and focused manner so that the relevant information is conveyed effectively.
Here is a framework to use for presenting your patient. Present the patient's chief complaint and reason for their visit. Use the patient's own words if possible. For example, I'm constantly urinating, doc. Provide the patient's basic demographic information, such as age and gender. For example, Tommy is a 75-year-old white male seen in the clinic with a new onset of urinary frequency, urgency, and dysuria for 3 days.
Present the HPI. Provide a brief chronological account of the patient's symptoms, starting from when they first noticed the issue. Mention any exacerbating or relieving factors. Include any self-treatment or interventions attempted by the patient. Remember to use old carts, as described in the previous videos. Then summarize the patient's relevant medical conditions, including chronic illnesses, previous surgeries, and significant medical events.
Highlight any medications the patient is currently taking. Examples include patient has a past medical history of diabetes, BPH, and HLD. Patient is on metformin 1000 milligrams BID, Lipitor 40 milligrams PO daily, and Flomax 0.4 milligrams daily. Make sure to share the patient's social and family history. Include relevant information about the patient's lifestyle and social factors that may impact their health, such as smoking, alcohol consumption, occupation, and living situation.
Make sure to mention any recent significant life events, changes in social support, or relevant environmental exposures. Mention any pertinent family history if applicable. Up next is the pertinent symptoms or findings from your review of systems. Focus on the areas related to the chief complaint.
Next, describe the key findings from the patient's physical exam. Make sure to highlight any abnormal or relevant findings that may guide the diagnosis or management.
Once completed, share any diagnostic test already performed, including the results and their relevance to the patient's condition. Follow up your assessment and plan by offering your evaluation of the patient's current condition and differential diagnoses.
Outline the proposed plan for further investigations, interventions, and management. Include any specific questions or concerns you would like the preceptor to address at this time.
And once you're done presenting your patient, be prepared to engage in a discussion or answer any questions the preceptor may have. In this lesson, we will review the two most common health problems noted by our adult nurse practitioners. In our clinical booklets, we have a total of 5 common adult health problems, as well as how to evaluate, treat, and manage them. We recommend you viewing them prior to your clinical rotation. Diabetes mellitus type 2 is a condition in which individuals have an impairment in insulin production and/or insulin resistance. It is known to affect 9.3% of the population, and predisposing factors include obesity, family history of diabetes, hypertension, being of Native American, Hispanic, Asian, or African American descent. Common complaints include polyuria, polydipsia, and polyphagia, as well as weight loss and a lack of energy. The physical exam of the patient should include an oral exam, a fundoscopic examination, inspection of feet with monofilament testing, and skin folds for erythema. Diagnostic testing includes a hemoglobin A1C and a fasting glucose. A fasting glucose is the earliest detectable glycemic abnormality in a patient with type 2 diabetes. The treatment plan for diabetic patients includes creating goals centered on metabolic control and preventing complications. If the hemoglobin A1C is less than 7.5, lifestyle modification alone should be implemented with reassessment of the patient's hemoglobin A1C in 3 to 6 months. However, if the hemoglobin A1C is greater than 7.5, begin medications, start the patient on an exercise program, implement a nutrition plan, and start the patient on metformin. When on max dose, if the goal is not achieved in 3 months, a second medication should be added. Any patient presenting with a glucose above 300 milligrams per deciliter or hemoglobin A1C of more than 10 should be started on insulin. Insulin should also be considered in those patients who are failing 2 to 3 diabetic medications, or if the patient has ketonuria. Follow-up for patients with diabetes is based on the type of diabetes, the age, client complaints, and any treatment changes and complications. For health maintenance, the patient should have an ophthalmology exam every 2 years, and the monofilament foot exam should be done in each follow-up. The nurse practitioner should recommend a yearly flu shot and obtain labs such as a serum creatinine, a BUN, GFR, lipids, urinalysis, and albuminuria. Referral to an endocrinologist should be considered for a diabetic ketoacidosis patient and any patient with neuropathy at the time of diagnosis, as well as persistent uncontrolled diabetes. The next most common adult problem we will address is the urinary tract infection, or UTI. A UTI is an infection of the urinary bladder. This means that a UA or urine culture has at least 100,000 organisms per ml of urine in an asymptomatic client, or more than 100 per ml of urine with pyuria in a symptomatic client. They are upper and lower tract infections. UTIs in an uncomplicated, healthy patient with a normal urinary tract can be treated with antibiotics by mouth. However, for those that have a complicated UTI, meaning that they are immunocompromised or have an altered urinary system, treatment requires IV antibiotics. The incidence of UTIs for young men is rare and includes ages 15 to 50, and it can be as high as 15% in the geriatric population. Approximately 6 in 10 women will experience a urinary tract infection at some point in their life. Older women are also more affected due to the estrogen-mediated dilation of the urethra. Elderly male infections are related to problems with the prostate and instrumentation. Bacteria ascend from the perineum through the urethra, with E. coli acting as the most common culprit. Predisposing factors include female gender, poor hygiene, sexual intercourse, diabetes, and anomalies of the GU tract. The most common symptoms are burning on urination, increased frequency, cloudy or bloody urine, and urgency. The elder adult may not have any symptoms or present with a fever, incontinence, or change in mentation. On physical exam, the nurse practitioner may discover CVA tenderness or suprapubic tenderness. Diagnostic tests include a clean catch urinalysis with reflex culture. Abnormal findings on a urinalysis that may indicate infection include cloudy urine, presenting with pyuria pus, blood cells, phosphate lymph, offensive odor, a pH greater than 7.5, and a positive leukocyte esterase and nitrates. Treatment is aimed at identifying the underlying cause and initiating medication promptly. In the case of the uncomplicated UTI, antibiotics should be used for 3 days. The duration may be increased to 7 to 10 days for a complicated UTI. Empiric antimicrobial therapy should cover all pathogens and confirmed based on the culture. Post-treatment urinalysis and culture is not indicated. Have the patient return if symptoms do not resolve at the end of treatment or if they reoccur within 2 weeks. You may also consider retreatment with 7 days of a different antibiotic. Advise the patient to empty their bladder often and avoid holding their urine. Schedule bathroom breaks every 2 to 3 hours if needed. For females, reiterate good hygiene habits like wiping front to back, taking showers instead of baths, voiding after sex, avoidance of feminine sprays and douches, and avoidance of tight underwear and clothing. Question number 1. What is the earliest detectable glycemic abnormality in a patient with type 2 diabetes? Great job. The answer is C, a fasting glucose elevation. Question number 2. When should you consider a referral for a patient with diabetes? Way to go. The answer is D. Question number 3. A patient with urinary frequency, urgency, and burning is found to have positive leukocyte esterase and positive nitrates on his urinalysis. A likely explanation could be you're right! C. Way to go. All right, so that's a wrap. I'm so glad you took the time to watch these videos so that you can be the best NP student your preceptor has had come through their doors. And don't forget to check out nphub.com to get access to all of our specialty notebooks. Reviewing these notebooks before and during your rotation will help you lay a foundation for a truly rewarding learning experience and maybe even a potential job offer down the road. Good luck.